tonight.
I have absolutely no family history of cancer at all. I didn't think I was a risk factor.
You never expect anything is going to happen to you.
An ABC 27 special presentation.
I did everything I could not to get it, and I still got breast cancer.
2 stories of hope and courage.
I was scared. The lump was so obvious, and I just kept thinking, how did I miss this lump?
Penn State Hershey Breast Center presents Hope and Courage, a tribute to breast health. Brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. This October is the 27th Breast Cancer Awareness Month. While the death rate from breast cancer has continued to decrease, only 55% of Pennsylvania women over the age of 40 receive annual mammograms. 1 in 7 women will be diagnosed with breast cancer in her lifetime. Tonight, specialists from Penn State Hershey Breast Center are in the ABC 27 call center to answer your questions about breast cancer. Just call the number on the bottom of the screen, or you can email your questions during the show to questions@abc27.com. Breast surgeon Dr. J. Stanley Smith will answer your emails throughout tonight's show. All calls, of course, and emails are confidential. We begin tonight with Deborah Pinkerton. As she's in the call center, she'll be sharing one patient's courageous story with you. Deborah?
Thanks, Chuck. It was Easter morning when a Lancaster County woman woke up and felt something very disturbing in her breast. She immediately knew it wasn't good.
This is just a great place to live. I grew up here, and my husband and I bought this place from my parents, and we spend Saturday evenings around the fire pit.
The sparks keep Rick and Brenda Stauffer warm and cozy.
Wow, you got it going good.
On this cool, crisp evening, Rick and Brenda reminisce about the many happy times and some unforgettable sad times, too.
For a few months, I felt a little burning pain in my right breast, and I ignored it because it was just little twinges here and there.
But on Easter morning of 2010, Brenda says the pain was unbearable.
I woke up to it. It was actually burning to the point where I woke up and felt this burning pain that didn't go away. So I started feeling around, and I felt a lump in there, and I went down to my husband and I said, "What do you think of this?"
She asked me to feel, and when I felt it, I thought, oh boy, this is not good.
My thought was, wow, how did I miss that? Because the lump wasn't little. It was a pretty good sized lump, but it was deep in. It wasn't visible.
What I thought I couldn't say, but no, it was gut-wrenching, you know, because you knew right away, I knew what it was, and she did too.
Breast surgeon Dr. Rena Cass confirmed their worst fear.
She had a mammogram and an ultrasound that then determined that there was in fact a lesion there that was correlating with what she could feel. She underwent a core biopsy or a minimally invasive biopsy where slivers of this lesion were removed, and it did show in fact invasive breast cancer.
Well, I cried. My husband cried. We cried together. My reaction was, oh my goodness, I'm following in my mother's footsteps because my mother had breast cancer.
Brenda was 40 when her mother was diagnosed with breast cancer.
My mother was 67 years old when she was diagnosed with breast cancer. She did go through radiation, and she went through a form of chemo. It was a form of pill. But in her case, it had already gone beyond the breast and had spread. My mom was 68 years old. She was too young. She was too young to die.
A very sad ending. Brenda did not want to repeat.
After the initial shock of it, then I felt like, okay, this is what you have. This is what you're gonna do. You're gonna sit down and dig in and do what you have to do.
We talked to Brenda about the options, the surgical options that she'd be a candidate for. And those would be breast conserving therapy, which would be a lumpectomy followed by radiation, getting clear margins around, nice zone of safety around the tumor, or a mastectomy.
Brenda chose a mastectomy.
I had the surgery on June 1st. It was my birthday. And I thought, happy birthday to me. I get to have surgery today.
At the same time, Dr. Curtis Moyer performed a special kind of microsurgical breast reconstruction called a free tram flap procedure.
The specialized procedure that I do here is taking abdominal tissue from the patient's abdominal region, fat and skin, and move that up to the breast after the mastectomy has been performed. The benefit of the procedure is that it's their own tissue, so it feels and looks more natural than a silicone implant.
She went in at 10 in the morning, and it was like 11:15 in the evening when she came to. She goes, "Well, that didn't take long." I said, "What do you mean?" I said, "It's 13 hours later."
Brenda needed time to recover, time to heal, but she wasn't finished.
She needed chemotherapy because of the invasive nature of the tumor, the positive nodes, and the fact that she had this special subtype called HER2 positive. She participated in a national clinical trial that's being conducted here at our medical center. And she got a combination of chemotherapy, a special kind of chemotherapy, plus the antibody Herceptin, the antibody against the HER2 target.
2 weeks after the first chemo, my hair started, you know, I could pull it and it came out, and then my husband shaved my head for me.
I said, "I can't wait to shave your head. I can't wait to shave your head. Then you'll look like me." And you know, the day of it, it was very hard to do it.
Chemotherapy, that was definitely the hardest time. From the time of the diagnosis all the way through the 6 chemo treatments were the worst.
Brenda says her family, especially her grandkids, gave her strength.
I always took pictures of my grandkids with me, so that got me through.
Little steps of encouragement that made a huge difference on her journey.
I feel fortunate to be married to my best friend. I feel fortunate that my children supported me. I had a great support system.
Now everything seems to be going good, and you know, she's getting back to her normal self.
I feel great. Life's good.
And life is good for Brenda. Dr. Cass says Brenda is disease-free. Chuck, we'll send it back to you in the studio.
Thank you. Deborah, I'll tell you, that attitude, you can tell it just jumps off the screen, that winning attitude. Joining us here now in the studio is Dr. Curtis Moyer. Doctor, we watched you do that procedure, and you talked about it in there. How long has that procedure been around?
The particular procedure that Brenda had, microsurgical breast reconstruction, in the form that she had, it's been around about 15 years. In the last 10 years, it's become more popular as more surgeons are becoming trained in this advanced procedure.
And there have to be pros and cons no matter what the procedure is. Talk about some of the pros and cons, one procedure over the other as far as the patient's concerned.
Sure, absolutely. The pros of this particular procedure are that it's the patient's own tissue, so it's going to feel and look more like a natural breast. In addition to this, because I'm using abdominal tissue, women will have a reduction in their waistline, similar to an abdominoplasty or what is often called the tummy tuck. The other pro to that particular procedure is that there's less of a maintenance for that particular type of procedure. And that means that over time, women don't have to worry about having different procedures that may come down the line with implants.
And so the procedure's 8 to 10 hours long, and I'll tell you, that's tough there. What are some of the cons? We talked about the pros. What's negative about it?
The cons are, as you had said, it's a much longer surgery than doing implants. So from a standpoint of whether or not a patient's able to go through with the procedure depends on their consultation and whether or not they're a candidate for that procedure. But again, the benefits are it's a much longer lasting reconstructive procedure than a silicone implant.
Is every candidate that's had a mastectomy, are they a candidate for this type of reconstruction?
Unfortunately not. Women who are undergoing this particular procedure, because it's a longer procedure, would need to be healthy and able to undergo an 8 to 10 hour long procedure. But again, one of the benefits of having this procedure available at the Penn State Hershey Medical Center that I perform is that it gives local women a chance to have this advanced procedure. Up until recently, this procedure was only available in Philadelphia and Pittsburgh, but now I perform it at the Penn State Milton S. Hershey Medical Center.
Good news, it's local.
Yes, absolutely.
Thank you for joining us tonight, Doctor. And let's check in with Deborah in the call center. Deborah?
Thanks, Chuck. The phone lines are busy. If you need to get through, just keep on calling. You can also email your questions to questions@abc27.com. Now, here to answer our first viewer question is Dr. Susan Cheddar, co-director of the Breast Center. Thanks for being here. The question is, I found a lump in my breast that is very painful, but it does not show up on an ultrasound or mammogram. Should I get a biopsy?
My advice to any woman who felt a lump in her breast, if a lump is new in your breast and that is a change for you, regardless of what someone may tell you about a mammogram or an ultrasound, you should see a breast specialist, preferably a breast surgeon, to have your breast examined, and they can determine whether or not a biopsy is necessary.
Okay, thanks, Dr. Cheddar, and we will have more viewer questions coming up a little bit later in the show. Now, if you would like to schedule